Oh, we like to talk about new procedures. We're seeing so much progress in the medical field. There's a doctor in North Georgia using such a procedure when it comes to treating heart disease.
Latrice Curry shows us more in her ION Health Report. Latrice.
Well, by using this technique to treat heart disease, it not only makes the procedure better for the patient, but also there is less risk for complications.
Getting a heart catheterization to treat heart disease usually meant this: a painful and uncomfortable procedure for patients.
Going through the groin is uncomfortable for the patient. It used to be a universal way of doing it, but over the past few years we've been changing and going more and more through the wrist.
Dalton cardiologist Dr. Azad Ahmed is now on the cutting edge with a new procedure when it comes to heart catheterizations.
The technology continues to evolve.
Rather than go in through the groin or wrist, he inserts the catheter into an artery at the base of the thumb.
The whole process is a lot more comfortable for the patient, and that seems to help with compliance and understanding of what they're going to go through.
Dr. Ahmed says while this procedure is a bit more complicated to perform because he has to move the catheter around more and also use ultrasound, it's better for the patient with fewer complications such as potential damage to the artery or nerve damage. And the patient gets to leave the hospital sooner.
With this, you can potentially go home after 1 or 2 hours. And in fact, they could go home even sooner. It takes a lot of logistics to get somebody out of the hospital. So our average is about 2 hours after the procedure. They can go home, walk around.
Well, now, Dr. Emmett says that there are still some patients where he has to go through the groin for a heart catheterization, such as those who have bypass surgery. But for mostly all of his other patients, he uses this new procedure. In the studio, Latrice Curry, Channel 3 Eyewitness News.